Today I will be speaking to you about the role physical and occupational therapy play in your road to recovery. Exercises are a key piece of the recovery plan. It is beneficial to start exercising before your surgery. This will allow you to gain more strength and range of motion before your surgery for improved outcomes. You can access your preoperative exercise program on your online platform. You can pick which type of surgery you are having and follow that exercise program. These exercises should be completed 3 times a day, morning, afternoon, and evening. The repetitions for each exercise depend on your tolerance level. We use a patient engagement portal that will give you a suggested goal to work towards. Log into your account for specific details or ask your doctor for details. You will be seen by both a physical and occupational therapist during your stay at the hospital. The therapy team will see you on the day of surgery. The physical therapist will assess your ability to get out of bed, stand, walk, stair training as needed, and will review your exercise program. It is important to continue your exercise program when you are discharged for best outcomes. The occupational therapist will assess your ability to perform ADLs, bathing, dressing, toileting, and getting in and out of a car. The team will continue to address your needs while in the hospital for a safe discharge home.